I had a patient who stopped taking his medication because a 30-second video from an influencer who had great lighting and zero medical training told him the pills were poison, that the whole thing was a scam and that real health came in a supplement bottle instead. He believed it. He stopped, and a few months later, we met in my emergency department dealing with the exact consequence we had been preventing all along. G'day team, and welcome back to Overheard in the Emergency Room. I'm Dr. Coyce, emergency physician and evidence nerd. I want to be really clear about what this video is and what it is not. It is not me telling you that every medication is wonderful and you should never ask questions. Good medicine welcomes hard questions. What I am giving you is a framework for asking the right ones, so you can tell the difference between a legitimate concern and a fear that someone manufactured in order to sell you something. This is the pillar for every medication series. Every drug-specific video builds on the thinking we set up here. So if you enjoyed this episode, subscribe and stick with me, because this framework will outlast any single headline. Let's get into it. Medication fear is not an abstract internet problem. It is a clinical problem I see every single shift. Someone stops taking their blood pressure tablets because someone told them the side effects were being hidden from them. Someone halves their own dose without telling anyone. Someone swaps a proven medication for a supplement stack a stranger sold them. And the bill for that bad information comes due in my department in the form of strokes, of heart attacks, and of things we could have prevented. But here's the good news, and this is the same good news I give in every one of these videos. The defense against this is not a medical degree. It is a way of thinking, and a huge part of that defense is learning to spot the manipulation tactic before it ever gets you. So we're going to do this in a specific order. First, I'm going to name the tricks, because once you see the tricks, they stop working on you. This is called pre-bunking, and it means inoculating yourself against the tactic before you ever meet the myth. So tactic 1, the naturalistic fallacy. Natural tells you where something came from, not whether it is safe or not whether it works. Hemlock is natural. Plenty of the most powerful drugs we have started life as plants. Natural is a marketing word, not a safety rating. Tactic 2, the anecdote dressed up as evidence. My cousin took it and they got really sick. It feels powerful, but a single story cannot tell you whether something is safe across millions of people. Real safety data comes from trials and large populations, not from a comment section. Tactic 3, the amplify a scary headline. This drug doubles your risk. It can sound terrifying, but doubling a tiny risk is still a tiny risk, because twice almost nothing is still almost nothing. Always ask, double of what? The honest number is the absolute risk, and it is usually far less dramatic than the headline will tell you. Tactic 4, cherry picking. If someone cites the one study that supports their take and ignores the 50 that don't, that is not science. That is a debate club move dressed up in a lab coat. Real findings will still hold up across the whole body of evidence, not just the convenience slice. So now that you can see the tricks, here is the constructive half of this episode. There are 4 questions to ask about any medication, whether you are deciding to start it or being tempted to stop it. So question number 1, what is this actually for? And what is the benefit? Not in vague terms, in real ones. Is this treating a symptom, or is it preventing something serious down the line? Doctors think in terms of how many people need to take a drug for one person to benefit. You do not need the jargon, but you can ask in the spirit of it. So ask, how much will this likely help me? Question 2, what are the real risks and how common are they? Every medication has side effects, and so does every choice not to treat. The skill is separating the common and mild from the rare and serious. A leaflet listing 50 possible effects is not telling you they are likely. It is telling you they have been reported. Ask which ones actually matter and how often they happen. Question 3, what happens if I do not take it? This is the question that fear-mongering always leaves out. Stopping a medication is itself a decision, and it carries its own risks. The influencer who tells you to quit never has to face the heart attack on the other side of that advice. You do. So weigh the downside of the drug against the downside of the disease, honestly, on both sides. Question 4. Is there a non-drug option that is genuinely as good? Sometimes there is, and a good doctor will tell you that. For many conditions, lifestyle changes are real medicine, but as good has to mean as good, not makes me feel more in control. Ask honestly and be honest with yourself about the answer. And here's a few practical notes that really matter. Do not stop suddenly on your own. Some medications are genuinely dangerous to quit abruptly, and the right move is always to ask your prescriber about it and plan ahead. There are pharmacists who are a free expert. They are deeply trained in exactly this. They are easy to reach and they love these questions, so use them if you can't get into your primary doctor. Interactions are real. A drug that is safe on its own can behave differently alongside another, which is why your team needs the full list of whatever you take, and the supplements are not exempt from any of that. A supplement is a regulatory category, not a safety guarantee. They can interact, they can harm, and they deserve the exact same 4 questions. So the next time a confident stranger tells you to fear your medication, run the framework. Spot the trick tactic they're trying to use, naturalistic fallacy, the scary anecdote, the amplified risk headline, the cherry picking. Then ask the 4 questions. What is the benefit? What are the real risks? What happens if I do not take it? And is there a genuinely equal alternative? That sequence will protect you from far more harm than any single hot take ever caused. And here's your callback to our Tier 1 framework. The antidote to medication misinformation is not a better influencer. It's a real relationship with people who know you. A primary care doctor and a pharmacist who have your history and your trust will outperform any algorithm every time. Those are the ones that can answer your questions based on your history. And once again, having a primary doctor is the single highest leverage step you can make in your journey to better health. And that is it. That's the framework. If that gave you a clearer way to think, please subscribe and hit that notification bell, because the rest of this series takes the medications people are most afraid of and runs each one through exactly this lens. Tell me in the comments which medication you want me to tackle first. And I am going to start with the biggest one in the headlines right now, the GLP-1 drugs. I'm going to run through this framework piece by piece. If you like this episode, head over to drkois.com to get the companion blog. I'm Dr. Kois. Let's chase less bad days and more good decades together. See you next time. And hopefully not in my emergency department.